My name is Raaid Museitif. I'm born and raised in Wisconsin. I'm from Kenosha originally. I went to University of Wisconsin for undergrad and medical school. And then I received board certifications in internal medicine, cardiology, interventional cardiology, nuclear cardiology. I specialize in structural and vascular medicine as well. So tonight we're going to be talking about hypertension. So we got a few different jokes. But first of all, we're going to talk about what hypertension is. And hypertension itself is just a condition where a patient has a higher blood pressure than what we judge as normal. And we're going to talk about why that's important in these slides. The pressure itself is exerted by the flow of blood in the walls of your blood vessels. We'll also talk about your blood vessels. Your blood vessels are very dynamic. They're not just tubes, but there's several layers of tubes. There's like an inner tube, and then there is all these other different layers, and one of them includes a muscle layer. And so these blood vessels can actually dilate, open up, and close to adjust for blood pressure. So when your blood pressure is too high, your blood vessels can actually expand, and when they expand, they have increased volume, and that drops the blood pressures in wall. A lot of the things that affect and cause hypertension actually damage this mechanism. But blood pressure itself, it's really amazing when you look at the body, because so many different parts of your body affect your blood pressure. Your kidneys, how much fluid that they retain, how much sodium and salts that they retain in your body. And your kidneys also send signals to the rest of your body that can affect your blood pressure. Your heart can affect your blood pressure. Your heart acts like a pump. And so if your heart is pumping really hard, it fills the blood vessels up with blood, and that can elevate your blood pressure. And then we also have what we call the neurohormonal system, where nerves and chemicals in your body that are released can also affect your blood pressure. The arterial pressure is what we call how the pressure inside the blood vessels, the arteries. And just as a side, you have two different sets of blood vessels. You have the arteries, and you have another set of system called the veins. So the arteries are the tubes that actually take the oxygenated blood from your heart and distribute it to all your organs. So if you think about plumbing, the arteries are like the city water, the clean water that comes to your house and travels through all the pipes and ends up in your sink and faucets. That's arteries. Now that water that's in our house also has to go through a drain system and be recycled. And in our body, that's the veins. And so when we talk about blood pressure, we're talking about the arteries, the ones that are full of blood with oxygen and energy in them. Any blood pressure, typically that's above 140 over 90 millimeters of mercury, is considered abnormal. And what is normal or abnormal has a lot to depend on your age as well. So different age groups and different medical conditions that people have, we set different parameters for what we would consider elevated blood pressure. So what's a normal blood pressure? Anything that's below 140, the top number, that's what we call the systolic pressure. And the bottom number is called diastolic blood pressure, and anything below 90 millimeters of mercury is considered normal and adult. Now, the average ranges are below that. The average systolic pressure is around 120 millimeters of mercury, and the average diastolic blood pressure is around 80 millimeters of mercury. And you have two different pressures in your arteries, and it coincides with the pumping of the heart. When the heart squeezes, it floods all of your arteries with new blood that has oxygen and energy in it, and that push of the heart into the blood vessels quickly raises the blood pressure, and that's what we call systolic blood pressure. And then the heart relaxes, and as it relaxes, all the blood moves through the pipes, and the pressure drops, and that's where we get the diastolic, the lower blood pressure of 80. So we have a different grading system, and again, this is just a general kind of grading system. We and your physicians, your providers should tailor this to you, your age, your risk factors, your race. But again, a normal blood pressure, anything around 120 millimeters of systolic and 80 of diastolic is considered normal. When you start to creep up and get just below 140, below 139 and below 90, we call that pre-hypertension. And then once your systolic pressure is above 140 or diastolic above 90, we start to call that your first stage of hypertension. And then we go up to stage 2, where you're having blood pressures greater than 160 milligrams of mercury and a diastolic of greater than 100. Now, I'd caution you on the diastolic blood pressure because we used to pay a lot of attention to that. But now we think the most important is the systolic. And a lot of our machines that measure blood pressure are more accurate for the systolic than they are for the diastolic. So we really tend to focus on that top number. Okay, how do we measure blood pressure? Well, it's kind of simple. We stick a blood pressure cuff around your arm or your wrist, and everybody who's on this call, I'm sure, has had your blood pressure checked. And we squeeze the little ball, or sometimes they're automatic now, and it just keeps increasing the pressure on the cuff. And we know what the pressure in the cuff is. And so we go way high until the blood pressure in the cuff is higher than the blood pressure in your arteries. Once that happens, we stop the blood flow in that blood vessel. And then what we do, we stick a stethoscope, or like I said, some of you may have an automated machine that can detect the sound of blood. And we slowly release the pressure in the cuff. Once the cuff pressure is less than the pressure in the arteries, we can hear the blood flowing again, and it makes a sound. And once we do that, then we can see what the blood pressure is in the cuff, and that's how we can tell you what your blood pressure is. Now, when you take the blood pressure, it's important that we're accurate. And we don't rely on just one blood pressure. There's a lot of factors that can increase your blood pressure. If we stick a sheath, a detector inside your artery like we do in the intensive care units, we can watch your blood pressure on an instantaneous basis. And it looks like you're at, Six Flags Great America. The blood pressure keeps changing, up, down, up, down. If you're angry or fearful, or if you're sitting in a doctor's office too long getting stressed, or if you have what we call white coat syndrome. And white coat syndrome means that every time you're in a doctor's office, your blood pressure is higher than it normally is, then we can overestimate it and think that you have higher blood pressure than you actually do. And this really came to light once we started to get the home blood pressure cuffs. We started to realize that patients' blood pressures at home, when they're not in a doctor's office, a lot of times tend to be less and lower than they are in our offices. And that's why it's real important that you have a blood pressure machine at home and you're able to check it there, because we really want to see what your average blood pressure is over a longer period of time. If you check a blood pressure and it's high once, then we just recheck it, but we wouldn't give you that diagnosis. Other factors is that your blood pressure, the cuff that you put on your arm, has to be the right size. All of us come in different sizes and shapes. If you have a blood pressure cuff that's too small, it would be too tight on your arm, and that will overestimate your blood pressure. It'll make your blood pressure look too high. If your blood pressure if your cuff is too big, it'll make your blood pressure falsely too low. Okay, how should you do it? Well, again, I think most of you probably have a blood pressure cuff machine at home, but when you check it, you should be sitting in a chair, and you should really sit for 10 to 15 minutes before you check it. That allows everything to calm down. See, when you get up out of your seat and you walk around, your body kicks in because gravity pulls the blood away from your brain and pulls it into your legs. Your brain then senses a lower blood pressure, and it sends signals to your heart and blood vessels to, hey, pick it up. Then your heart speeds up to pump more blood, and your blood vessels, remember I said that they have muscles in them, will force your blood vessels to shrink to bring the blood pressure up. So if you check it immediately after you're exercising or when you're walking around, it's going to be higher than your real true averages. So that's why you should sit down and relax. You shouldn't be hungry. You shouldn't be upset, angry, or stressed. All those factors will give you a falsely high blood pressure. You check it on your upper arm after you're relaxing. You should always check it kind of in the same arm. Now, sometimes people can have different blood pressures in both arms. That happens when you have a blockage in your what we call subclavian arteries. Those are underneath your clavicles, you can have a blockage there that can affect one of your blood pressures. So we recommend you check both of them. And if they're about the same, then you always just check it in the same arm, in the same spot, in the same position. And so that way we get rid of all these other factors that can mislead us. All right, how do we classify high blood pressure? There's two broad categories of blood pressure, and we call them primary blood pressure hypertension and secondary hypertension. And what that breaks down to is most of us, 90 to 95% of the people will have what we call primary hypertension. And that's just a fancy way of saying that we actually don't know why you have blood pressure, high blood pressure. It's not something that we can identify that we can fix. And so we say that you've just developed high blood pressure. Now, there's other categories called secondary hypertension. Some people can have normal blood vessels, normal heart, but they have other organs that are damaged. So, for instance, if you have a kidney disease, sometimes that can elevate your blood pressure, and we would focus on treating the kidney disease over the blood pressure so that we can correct it. Other tumors can cause it. Remember, I said something called the neurohormonal system. So you release all these hormones in your body that can affect your blood pressure. And sometimes people develop tumors and they can release hormones and cause your blood pressure to go high. Other things are what I was telling you about the subclavian stenosis. You also have a big pipe that comes out of your heart called your aorta. And people can develop strictures or narrowing in the aorta. And that causes a smaller diameter, and your blood pressure can be elevated with that as well. People during pregnancy can have higher blood pressure. And so we look for secondary causes of hypertension before we label you with the diagnosis of primary hypertension. So what are the signs and symptoms of high blood pressure? Unfortunately, blood pressure is also called the silent killer. You don't feel it. Most people go on for years and they don't even know they have high blood pressure because they just can't feel it at all until you have some type of damage. We know from a population studies that most of us, if you're blessed to live long enough, will develop high blood pressure. And a simple rule is by age. So if you look at all 40-year-olds, 40% of 40-year-olds have high blood pressure. 50% of 50-year-olds have high blood pressure. 60% of 60-year-olds, 70% of 70-year-olds, 80% of 80-year-olds, and we're having a lot of people in their 90s and 100s, and 90% of 90-year-olds will have high blood pressure. When your blood pressure is there for a long time, you may start to develop symptoms if it's not treated. The worst symptom is what we call hypertensive emergency, and that's where the blood pressure is so high, you start to get damage. And that damage could result in a stroke. People end up in a hospital with a stroke and their blood pressure is really high. It can cause a heart attack, and it can damage your kidneys. It also damages your blood vessels. But those things are called, those are hypertensive emergency, and you end up in the ICU. Other people can develop these symptoms that are on the screen. People can feel it sometimes with headaches. They can have dizziness. They can sometimes have mental confusion, even though they don't have a stroke, or they can have vision can be affected. And those are very worrisome because you could be developing a stroke if it's left too long. People can faint, they can become nauseous, and they can have even bleeding from their nose called epistaxis. So what do we do about it? Well, when we talk about the risk factors of high blood pressure, we're going to talk about those. We break them down into two categories. The first one on the top is non-modifiable risk factor versus modifiable risk factor. And what is non-modifiable risk factors? Those are risk factors that you can't really do anything about. I mean, I wish I'm not, blessed to be older, but your age, you can't do anything about it. And we already talked about 40% of 40-year-olds, 50% of 50-year-olds, so on and so on. So as you get older, you're more likely to develop high blood pressure. The other thing is you can't pick your parents. And so there is a genetic factor to developing hypertension and a family history factor. And it is what it is, and you can't do anything about it. But there are other risk factors that are so-called modifiable. We can do something about them, and we're going to go into those in depth. But some of those You've all heard of them, and you might have some of these states, but elevated cholesterol can increase your blood pressure, and we'll talk about that. Diabetes, obesity, smoking can increase your blood pressure. Sedentary habits, we are iPads and on the internet and social media. There's environmental stress, and stress is really interesting. We'll talk about that. The medical community has gone back and forth on how bad stress is for somebody's body, and can stress cause heart attacks? Can it cause high blood pressure? And it was a hot topic 25 years ago, and then it kind of went away. And now we're recognizing that it can affect your blood pressure and cause damage, and can lead to other problems, including heart attacks. Lack of exercise. Not doing cardiovascular exercise, not walking, can increase high blood pressure. Salts. So the interesting thing about salt is that water follows salt. And so when we have a high salt diet, that salt goes inside your blood vessels. And if you put a pile of salt on the table and you put a little water next to it, the water will go to the salt. It follows salts. And so high salt intake can increase the amount of fluid that's in your arteries and increase your blood pressure. Excessive alcohol can raise your blood pressure. Women who are on birth control, that can elevate your blood pressure. Vitamin D deficiency, especially in Wisconsin, because we don't get as much sunshine, can cause it. Now, let's go through some of those risk factors and talk about them. What do we know about the genetic factor? We do studies, and we do a lot of so-called twin studies, where we take twins who we think are identical and have very close genetics, and then we look at different environmental factors that they're exposed to, and we see if they have higher blood pressure than the average person would for their environment. And it can confirm, based on their parents, that there isn't a genetic component to it. A lot of times, the genetic component is linked to high cholesterol, and we'll talk about how cholesterol can damage your blood vessels and increase your blood pressure in a minute. Okay, so back to those twin studies, we look at the chance of somebody developing high blood pressure based on their parents. So if you have two parents who do not have blood pressure, then those children only have about a 3% chance of developing blood pressure themselves, high blood pressure themselves. If you have two parents that are hypertensive, they do have a diagnosis of hypertension, then their children have nearly a 50% chance, 45% chance of developing blood pressure in their lifetime. So there's a clear link between genetics and developing hypertension. So it's a funny joke. I don't know. I think it's funny. I was hoping that the high blood pressure would flush out all my cholesterol. So what about cholesterol? So there's different types of fats, animal fats and vegetable oil like olive oil. But the fat themselves, when you look at their structures, we call them saturated fats and unsaturated fats. So when we eat a lot of the animal products, animal fat, bacon, these are saturated fats. And what does that mean? Well, when you look at, you've all seen like pictures of like molecules. They have all these carbon atoms, but they also, if you can think of a circle and then they have little sticks outside, they can have some hydrogen atoms on the top. When you're saturated, that means you have a bunch of those hydrogen atoms. And the structure, instead of looking kind of mangled, it straightens out flat. The problem with that is when they're so flat, they really stack up on each other really tight. So those are really bad. They become, they become very, there's no room in them. And those blood vessels, if you look on the left, remember I told you about the blood vessel before, that they're not just one tube, but they're layers inside of layers. And the inner layer there, if you can see my mouse, this inner layer is called the intimal layer. And then behind that, there's a muscular layer and a connective tissue layer, and then an external layer. But fat tends to sneak in the crevices behind the inner layer, and it starts to develop plaque in the back. That's what you call plaque. The plaque starts to develop. And it's pretty interesting how it works. When you look at a blood vessel, it looks like a sheet of plastic. It just looks like a plastic tube. But when you go under a microscope, you realize that that's not a tube at all. Those are cells that look like circles, and they link onto each other through what we call gap junctions or gaps. They grab each other's hand. And there's so many of them that when you look at it through a naked eye, it looks like a smooth piece of plastic. The problem is when you have inflammation from high blood pressure causes inflammation, smoking causes inflammation, diabetes causes inflammation, stress causes inflammation, not exercising causes inflammation, and a lot of those modifiable risk factors. Inflammation causes swelling. It's like when you get hit and you get a bruise, it turns, you get a bruise on there. And the bruise is because your blood vessels open up and blood leaks out there and stains it. And you can see it, it swells up from the fluid. You get a bump on there. And that's because these cells swell open and fluid and blood can sneak through there and cause a bruise. And that's the same thing inside your arteries. Those gap junctions can stretch when they're inflamed. When they stretch, I don't know if you can see my hand, but now you can sneak things through the crevices of my finger. And your LDL cholesterol, your bad cholesterol, sneaks through there and goes behind the inner layer. Well, we have a very sophisticated immune system, and it's like a police department and army all combined. And it knows amazingly when things don't belong, whether they're a virus or a bacteria, or whether fat is in a restricted area. And when it knows that there's fat molecules that snuck through the gap junction and they're behind the inner layer, it activates the immune system. And you have these certain cells called macrophages. And remember the game Pac-Man? They're just like Pac-Man. They go back there and they chase the fat and they find it. They go right through the gap and they go back there and they eat the fat. When they eat the fat, they get bigger. They get enlarged like Pac-Man. Now, when they get big, they can't go back out. They're stuck. So our immune system trying to help us hurts us. And when they get stuck back there, they die and they become what we call foam cells. And then eventually a bunch of them start to develop these fat plaque layers. And those fat plaque layers slowly narrow your vessels. And that's when you start to get chest pain. That's when you can have heart attacks. That's if they develop in your neck, in your carotid arteries. You can develop strokes. They can go in your kidneys and develop kidney failure. They can go into your legs. And that's why people have something called peripheral vascular disease, where they can lose their legs. And that's all that process. Now, the vegetable oils are what we call polyunsaturated fats. And so there's not that many hydrogen atoms in them. And so they're curled up like a weird shaped ball. Okay. There's a lot of holes in it. The good thing about that is you can't stack that much fat in a little area because it doesn't stack flat like the saturated fats do. And so those tend to actually, other fats try to go in there like a sponge and then they get cleared out of your body. So they help you. So how does diabetes? Now, when we talked about cholesterol, what about diabetes? Well, diabetes accelerates that process of what we call atherosclerosis. Athero is your artery. Sclerosis is this damaging of it with the fat buildup. And just like it makes the process of that fat going in your arteries worse. And when you look at some of the risk factors like high blood pressure, diabetes, smoking, and obesity, you can take and find the risk factors for each one. But when you put them together, they're very bad. They're no longer just additive. So if we gave a score of you have a one risk factor if you have high blood pressure, and one risk factor if you have diabetes, and one risk factor for hypertension, if you have all three, then you should only 3 times your risk. But it's not true. You 3.6 times your risk. It's actually worse together. It's like dynamite, a wick, and a match. When they come together, they're very bad. And so that's why it's important to get your diabetes under control as well. What about obesity? Well, the higher the weight, the worse it is. If you have a minute, maybe not tonight, but sometime, you can just Google obesity trends in America and click images. It'll show you the obesity in each state of how much we're becoming overweight. And we'll talk about there's some of the reasons for that, but the entire country is becoming obese. And that's just a side effect of us being a wealthy nation. We have automobiles, we have all this processed food. You don't even got to leave your apartment anymore. Not only just to go pick your food, you don't even have to go to the grocery store. These kids are getting on their phones and just ordering food, pizzas right to their house, and they're not having to move, and our weight keeps going up. And you should just look at that for your own benefit to see how that's affecting us. But the higher the blood pressure you are, the higher your cholesterol is, and the higher your the blood pressure goes up, the more likely you are to have diabetes. Our fat deposits, especially around our stomach, actually suck out the insulin out of our body. And so our normal body has an organ called the pancreas, which is it's above your belly button, right below your rib cage. It sits there like a long organ, and that produces our natural insulin. And so it produces insulin based on how much sugar is in your blood, and it just produces just enough. But when we have so much extra fat on our body, the fat actually sponges the insulin out of our blood and it goes into our fat. So what happens if the insulin is not in your blood, then your sugar rises. And then that tells your pancreas, hey, we don't have enough insulin. And then your pancreas starts to produce more insulin. The problem is that's a bad circle and a bad cycle. Eventually, your pancreas can't keep up and you develop type 2 diabetes. Type 1 diabetes is what most people are born with. And that has to do with the cells in the pancreas that are just not functioning normally. And they're just not able to produce insulin. And that's why you see children who are born with that and they have to take insulin. All right. Well, we talked about the problems of being a wealthy nation. We're an industrialized, modern nation. And guess what? We don't walk. I mean, have you driven around the neighborhoods? What happened to the children? I don't see any kids outside. When we were children, we walked to school. We didn't even take a bus. We had bicycles and skateboards, and people were playing outside. Now, if you look at children, they're in the basements. They're playing video games. They're on their iPads. All of us, we get into our car. I mean, I'm guilty of it too. I might get into my car and drive a block to pick something up. We're not moving as much. That sedentary lifestyle is bad for our bodies. We're not developed to behave like that. That'll increase your likelihood of developing obesity, high blood pressure, diabetes, all those things. Now, the other thing is the lack of physical activity, and they may seem the same, but they're two different things. So our sedentary lifestyle means just normally, like people monitor their steps and say, I reached 10,000 steps. That's kind of like your activity that you should just be doing anyways. We should be walking. We should be walking to work or walking around the neighborhood. That's just part of normal living that we're not doing. But physical exercise is that you actually dedicate time and exertion and energy above and beyond your normal activity. So walking. So let me tell you a little fact, which I think is amazing. Everybody's listening, if you walk an additional 30 minutes in an entire week, which is like, it's like 5.5 minutes a day, extra, above and beyond what you're doing now, you can reduce the likelihood of having a major adverse cardiac event, heart attack, stroke, death, hospitalization by 14%, just by increasing walking 30 minutes in a week. So when I see my patients, I tell them, hey, our goal is to get you to walk an extra 30 minutes a day. And you don't have to walk all 30 minutes at once. As a matter of fact, there's no difference between walking 10 or 30 all in one time. So you can walk 3 10-minute walks as slow as you can. You can walk 6 5-minute walks in a day. And maybe you don't want to start with 30 minutes. Maybe start with 15 minutes a day. That adds up over the lifespan and can benefit you more than any medicine I can give you. It's going to help your depression. It can help your cravings with addiction like smoking. It can affect your weight. It can help build up your muscles in your body. So as we get older, there's a likelihood that we're going to fall and we can, break a hip or hurt ourselves. And by increasing your muscle strength by walking, you can lessen those effects. And so if there's one message I want to give you above and beyond hypertension tonight, is that everybody dedicates above and beyond what you're doing now, adding walking to your regimen. Now, what about stress? So we're in a high stress world. There's a lot of bad news out there and people are on the internet seeing bad images. There's stress at work. There's, economical and social stresses. And you have to learn how to deal with that because that can affect your high blood pressure. Walking is one of the best ways to do it. As you walk, you can actually, let me step back. When we stress, we actually release these cholesterol molecules in your body that cause stress. They're actually these hormones. They're like fatty hormones. And when you exercise, you actually use those as energy and you burn them off. And so by walking, you can help it. Meditating, I don't do yoga, but yoga helps people, Tai Chi, and exercise. What about salt? Well, everybody knows this, hey, let's try to cut out salt out of our diet. It's hard, especially when you get used to the taste of salt. It's very hard for people to cut out. Uh, why does salt increase your blood pressure? Well, it's what we told you that the water, the fluid follows wherever the salt is. And so when you ingest salt, it goes inside your arteries and fluid will follow that salt and it'll increase the amount of volume that's in your blood vessels and raise your blood pressure. Your kidneys, they're supposed to get rid of all that. But when we take a lot of salt in them, we can sometimes even overwhelm the kidneys and you'll end up raising your blood pressure. Potassium, like you find in some fruits and vegetables, especially bananas, can actually help. We use the word antagonize, but work against salts and can help your blood pressure. I don't want you eating 20 bananas a day, but if you eat a couple bananas a day, that can actually help lower your blood pressure, especially natural fruits, limes and lemons and apples. These can kind of help help reduce the effects of sodium, especially on your blood pressure. What about alcohol? Is any alcohol level safe? They used to say one glass of red wine is good for your heart. We don't recommend it just because I don't know anybody who can just have one glass of wine. But if you drink too much alcohol, that can also increase your blood pressure. And so the real thing is moderation. Try to limit it to one drink, to one glass of wine, one beer, if you can, if you're drinking every day. Again, we recommend not doing that, but if you do it, just try to limit it. Overdoing it, especially on a regular basis, can affect you. Well, I don't recommend this one either, but onions and garlic have been shown to help reduce your blood pressure. There's some Indian populations that use a lot of garlic and onions in their food, and we think it can help lower your blood pressure, but it'll also lower your friends and loved ones because nobody will want to be close to you, but it can help. Oral contraceptives, the birth control. Remember, we talked about the neurohormonal system. These can also raise your blood pressure. And I'd also point out that nowadays, people are on something called so-called TRT or testosterone replacement therapy. I know everybody who's watching here has seen these ads. If you're low on testosterone as a male, and then they give it to people, that can also have an effect on high blood pressure. And so, if you're on these, you should monitor your blood pressure to make sure whether it's affecting you or not. It's not everybody. It's not going to raise blood pressure for everybody, but it can. And so, you should just be aware of that and watch it. So, why do we care about high blood pressure? So, who cares? You have high blood pressure. Why do we care? Well, those things that we were talking about. Blood pressure ultimately damages your blood vessels. And when your blood vessels are damaged, it can lead to all these things on this list. If that plaque builds up in your heart arteries, those are the arteries that feed the muscle of your heart, it can lead to coronary artery disease, which can cause heart attacks and death. Once you get heart attacks and death, your heart can stop pumping correctly, and that's when you develop what we call heart failure. The third thing is cerebrovascular accident. That's just a fancy word for stroke. The carotid arteries take the blood from our aorta and feed our brain. We have two of them on each side of our neck, one the right and the left. They can develop the same plaque buildup like the other arteries, and that can break off. And when it breaks off, it goes up and lodges in a little branch in your brain. And the way the blood vessels work, they work like a tree. You have a big trunk, and then you have small branches. So a little chunk can float freely in the trunk of a tree because it's so big, but then eventually it travels down one of the little branches and it gets stuck. It can't go any further because the branches get smaller and smaller. When it gets stuck, now it blocks all the blood flow to go to that area of the brain that it was supplying, and it cuts off the oxygen to that area of the brain, and that develops a stroke. Aortic dissection, what is that? Well, Your aorta, again, is a big pipe, and that's like the main pipe. Just like we use the analogy of the water to your house, that's the pipe that comes from the city water to your house. And in your body, you have the same pipe. It comes out of your heart and it goes, and all your organs in your body run little pipes off it. Just like the water comes from the city, and my house takes water off it, my neighbor's house pipes into it and takes water off it. And then once it gets in my house, we distribute it to the toilets and to the sinks and to the refrigerator. And your aorta is the same thing. The aorta is also an artery, and it has layers inside of layers, and it bubbles. And when your blood pressure is so high for a long time, it can actually tear. You can actually tear the inner layer off. When you tear the inner layer off, then blood can no longer flow. You can develop heart attacks. You can develop stroke. You can lose your block off blood to your kidneys or to your intestines and to your legs, and it can be catastrophic. We go in there and try to repair that, but a lot of times it's devastating. Hypertensive encephalopathy, that's the fancy word for confusion. The blood pressure can be so high inside the brain that you really become confused. You're not aware of where you are. You can have headaches. You can have vision loss. And that's on the path of having a stroke. Those become hypertensive emergencies. Renal failure, meaning kidney failure, we talked about that. And blood pressure sometimes can be so high, the last thing on there is hemorrhage, bleeding. People can start bleeding from their nose, from their ears, from their eyes, from high blood pressure. That's very bad, and thankfully not too common. All right. So I've talked to you about all these risk factors, and we talked about things we can't change and things that we can change. So what if we change those modifiable risk factors? Does it do us any good? Okay. Well, let me tell you, I can't see you guys right now to say how many people are on high blood pressure medicines, but every time you're prescribed a blood pressure pill, and by the way, I know you hate them. Everybody hates high blood pressure pills, but I tell you, in the old days, they had nothing, and they used to put leeches on people and do bloodletting. It wasn't really effective, but that's what they had. So now we do have these pills, and those pills are designed to work on all the different systems that I talked about. So there's certain pills that work on the kidneys to block the signals that the kidneys send. There's blood pressure pills that work on the heart to prevent it from overreacting, to work on the nerves, to work on the hormonal system, to work on your water, to get rid of water. So we attack the blood pressure system by many different ways. And every time your provider adds another blood pressure pill, usually they're attacking a different system, not all the same system, because it doesn't really help. But the important thing is every time we give you a blood pressure pill, it should only lower your blood pressure, or its only effectiveness is about 10 to 15 millimeters of mercury. You can expect about 10 to 12. That's it. So if you're at 150 and we put a pill on you, we expect it to go to 140. Most people will need 2 to 3 blood pressure pills in order to be controlled. Okay. So knowing that, let's just call it 10, let's call it 12, whatever you want to call it. Okay. Can we get rid of these pills by attacking those modifiable risk factors we talked about? Well, let's look at weight reduction. If you're able to get your BMI, which is your body mass index, down to a normal range, you can drop your blood pressure 5 to 20 points per 10 kilograms. But 10 kilograms is a lot. That's like 20 pounds. But if you're able to get 10 pounds off, which most people in America can probably afford, including myself, you get rid of one of your pills. I mean, that's equivalent to a whole blood pressure pill. Weight does not come on in a day. It didn't come on the minute we graduated high school. I mean, I was overweight in high school, so that doesn't count. But so you don't expect it to come off quickly. You have a plan to take off a pound a month, 12 pounds a year. In a couple of years, you're down 20 pounds if you need it. And slowly taking it off and keeping it off, you can get rid of one of your pills. There's the next thing on the list is a DASH diet. We talked about fruits and vegetables. Getting rid of a lot of our fats, and it's very hard. I love cheeseburgers, I love pizza, but cutting down steak, bacon, and increasing fruits, vegetables, low salt, you can drop your blood pressure another 8 to 14 points. There goes another pill. So by eating better and losing weight, you get rid of 2 pills. Now, what about sodium? We talked about how bad salt is. What if we restrict our salt or reduce it? If you cut down sodium to a low level, just kind of the sodium that's already in your food, and not adding more. And I'm telling you, I'm preaching, but I'm not a very good follower here because I love salt too, but it's bad. Uh, if you're able to avoid it, you'll get used to it. But if you cut out the salt, you get another 2 to 8 points. And by doing the exercise, we talked about doing the walking, the 30 minutes a day. If you're able to walk 30 minutes a day and just cut out the salt without even losing weight, you add those two up, there goes another pill. So even if you can't lose weight, even if you can't cut out, I keep saying bacon, but you know what I mean, steak or whatever, just by cutting down the salt and doing the 30-minute walking, you might be able to get rid of one of your pills. I think that's pretty, as they say, cool. What about alcohol? Limiting it. We said a drink a day or less than 2 drinks a day. You can do another 2 to 4 millimeters of mercury drop. Now, that doesn't sound like a lot, 2 to 4 millimeters of mercury. But remember, I told you each blood pressure pill only reduces your blood pressure about 10 to 15 points. Every time we double the dose, so if you're on a 10 milligram pill and your doctor goes to 20, or if you're on 25 and they go to 50, that only gets you another 3 to 5 millimeters of mercury. So by limiting your alcohol, you may be able to cut one of those doses even in half. Maybe not all the way, but maybe in half. Now, these are not perfect, so I don't want anybody coming back and saying, I did this and my blood pressure didn't drop and he was lying to us. But this is what we see on average. All right. Well, what about treatment? We talked about things that we do and don't do, and we talked about getting blood pressure, but how do we prevent hypertension? Is there things we can do so that we never get it? Well, there's different strategies that we look at. We look at treating the population as a whole. We look at looking at populations that are already at high risk and addressing those. And then we talk about those secondary preventions, and we'll talk about all those. So population strategy, what do? Well, we look at our whole population. This is some of the things we try to do as we treat our patients in Stoughton and throughout the whole state of Wisconsin is the nutrition factor. We talked about this, but this is a strategy that we should just all do for many different reasons. But we talked about reducing salt. I sound like a broken record. Reducing fat, reducing alcohol. B, weight reduction, what we talked about. And like I said, I don't want anybody going on a crash diet, a fad diet. There's so many diets out there. They work, but they work while you're on the diet. None of us can sustain a diet. And the bad thing about diets is you lose weight. But when you lose weight, our body it's not just. There's no justice. You lose fat and you lose muscle. But when you gain the weight back quickly, you don't gain back muscle, you gain back fat. Now, the problem is when you're just sitting here listening to my lecture, we're all burning calories. And depending on your ratio of muscle to fat, the more muscle you have in relation to fat, the more calories you burn just breathing. So when you lose a lot of weight through a crash diet that there's no way you're going to sustain all your life, eating only protein, eating no fat, those types of diets that they have out there, you can't sustain that. You're going to do it, then you're going to go back to your regular ways. You're going to put the weight back on. You're going to put all fat back on. And then you're going to burn less calories sitting in a chair. So it's a very bad cycle. And that's why I advocate 1 pound a month, just not being on a diet, but changing your lifestyle, getting rid of snack foods out of your house, getting rid of popcorn and chips and candy and crackers. It's terrible. It's a terrible life, but it helps you because if it's not here, you can't get it. And it helps a little. Exercise, doing what we asked you to do and walk, and then behavioral changes, trying to reduce stress. People who stress you out, situations that stress you out, smoking, you're going to have to deal with them. Health education, we talked about all the other risk factors. Those risk factors, again, obesity, diabetes, high cholesterol, smoking. Going after all those things can affect your blood pressure. And self-care, monitoring your blood pressure like we talked about, sitting down, relaxing 10 to 15 minutes, checking your blood pressure, then recording that, the date and the time. Those are way more accurate than the ones that I do in my office because you're getting a whole big sample over a long period of time when you're at home in a nice environment. And that's what your blood pressure most of the time is. Just because it's high for a few minutes in the doctor's office might not mean that it's high all the time. And that's why it's important for you to check it. Okay, so that was the population study. What about high risk strategy as a population? We really try to identify people who are at high risk. Those are people who we talked about have genetic problems, have family members who have high blood pressure. That's why when you see a doctor, they ask you about your family history, what diseases run in your family, people who are obese, people who have diabetes, people who don't exercise, people who are smokers and alcoholics. Those are people that we really want to monitor their blood pressure to make sure that we're getting the right diagnosis and that we're instituting a treatment plan and that we're setting a goal for them and helping them achieve that goal. Okay. Oh, I think this is funny too. Is there a reason your blood pressure should be so high? And the patient responds, could the 2-hour wait in the waiting room be a correlation? Yes, it can. Okay. So thank you. That's it. I appreciate you all being here.